Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, March 30th. We're joined here today by Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of our Emergency Operations, or Office of Emergency Management, Matthew Pegg. We'll start with Mayor Tory today. Mr. Mayor.
Well, good afternoon. Last week, the city took urgent action to close playgrounds and other parks amenities because it was becoming all too clear that people were not keeping their distance from each other in these areas and were putting lives at risk, either their own or someone else's. That was a tough decision for me to make on advice of our Chief Medical Officer of Health, because we know that people love their parks and there's lots to be said for people being able to be outside. But it was also the right decision based on professional medical and health advice. We share, all of us who report to each day and all the many people who are working on this crisis, one incredibly important mandate: to save lives, to keep people healthy, and to do whatever we can to shorten the period of this crisis. COVID-19 is a deadly virus. It has killed more than 35,000 people around the world, including 6 Toronto residents. We've seen, as close at hand as New York City, what can happen in a big city in terms of both the spread of COVID-19 and the loss of life. The best way to avoid getting this virus is to keep your distance from others and stay home as much as possible. And that is why we've asked people not to use the playgrounds, the soccer fields, or the dog parks. With proper distancing, physical distancing, we did say it was okay to use the parks themselves, but that is superseded in most cases, if possible, by the advice to stay home. This past weekend, we saw posts on social media, received reports through 311, and heard from councillors about people continuing to gather together in larger groups in parks. People were playing soccer at the Weston Lions Park and at Humberline Park, having climbed over fences and gates that were locked there to keep people out during this health emergency. Others were using the fitness stations at Sunnyside Park, which had been clearly signed and taped off pursuant to legal orders. Large groups were hanging out in parks across the city, including Trinity Bellwoods, for example, and in the beaches. This is not physical distancing. It is irresponsible and insensitive behavior, and it risks spreading COVID-19 further in our community, just like we see on television in other cities. We need people to respect the closures that we have implemented. Reluctantly, we implemented them, but we did it to protect their own health, the health of their families, and the health of their fellow citizens. To make sure people get the message, parks crews were out today blitzing hotspots with Toronto Police and bylaw officers. Parking lots are being closed off where they can be. And while we always try to persuade and educate people, as we've been trying to do from the beginning, I'm afraid the time is up for those who don't want to listen or who don't care. And for them, we won't hesitate to issue a minimum $750 fine and potentially as high as $5,000 fines so that they maybe will get the message. And if you think about it as well, how silly is it for us to be expending resources on people at the 311 call center, and in places like that going around putting up signs that we put up already when someone tore them down, putting tape back up, and just repeating over and over again behavior that people should understand the first time. I will also say that we will take further action as needed to help further drive home that message, and that will mean, as often, that many could pay a price for the bad behavior of the few. Please be perfectly clear. We are doing all of this on professional advice to save lives. I know people have seen the stories on the news about the situations in New York City, in Italy, in Spain. We are doing everything we can here to make sure that people are safe and avoid spreading the virus. I want people to know that we are actively engaged in discussions with our public health experts about what more needs to be done to help stop the spread of COVID-19 here in the City of Toronto. I will support, as Mayor, additional thoughtful, evidence-based measures which will save lives, preserve the health of others, and shorten the period of this crisis. And I will do it precisely because it will save lives, preserve the health of others, and shorten the duration of this crisis. In that regard, I want to thank Premier Ford and his government for the additional measures announced today, especially those aimed at protecting our 70-plus population. On a positive note, we are as a city making progress in some areas in our fight against COVID-19. We have moved quickly to help people across our city at a time when we know they need that help the most. We have contracted with 5 hotels with a total of up to 650 rooms to help our homeless population. 2 of the sites are already in use, and we are in the process of identifying required supports and activating the others this week. A further 5 hotels with up to 500 rooms are in the process of being secured, and additional hotel and vacant property sites are under investigation. I should tell you that city staff are actively looking for other sites, and we're trying to see if some of those vacant sites could be converted to permanent housing to help with our affordable housing shortage once this crisis has passed. We are moving to rapidly house people in vacant Toronto community housing units. 19 housed this week, 50 additional housing units have been identified. And we are opening this week a site for the homeless who test positive for COVID-19 so that they can recover. This facility is the first of its kind in Canada. We've done this in partnership with the province, and the facility includes wraparound health and medical supports that we know people will need as they recover. City staff also worked through the weekend so that those who collect Ontario Works monthly payments in person are able to do so safely at select locations across the city. We are also the first city in Ontario to develop a plan for 24/7 childcare for frontline workers who need it. The application process was opened over the weekend, and the sites themselves will be up and running this week. This is all good, important work that has been done by the city and by city employees in conjunction with organizations in the community, and it has been done as fast as could possibly have been the case during these unprecedented times. To help support our frontline TTC workers, I want to urge businesses that remain open to help them, please, along their routes. They brought to our attention the fact that some businesses who previously accommodated employees for mid-route bathroom breaks are either closed or they're open but no longer allowing those operators in. Those operators, those bus drivers and streetcar operators and others, are serving us at a time when we need them to serve us, and we need to help them as they carry out their duties for us. So I would ask that if you are one of these businesses that are still open, that you accommodate these employees, these public servants who are doing tremendous work for us to keep the city moving, especially for people who are healthcare workers and others in caring for the elderly and working in grocery stores and other places where we need them to be. They are keeping us going, and we want them to be able to get to work, so please help them. I want to thank all of our workers for their tireless efforts so far and for the work they will be doing over the coming weeks as we continue to deliver essential and critical city services. I want to send my best wishes as mayor for a speedy recovery to all of the frontline workers, indeed to everybody who is suffering from the COVID-19 virus, but to the members of our team who have fallen ill, I wish them all the best for a very speedy recovery. We know that this is a marathon and not a sprint. We've said that from the beginning. People all want that to end tomorrow. That includes me, it includes all of us who speak to you each day and bring you up to date. We want life to return to normal as soon as possible for your sake and because we enjoy such a wonderful way of life in this city. But the only way that we're going to get through this, the only way we are going to save lives, protect health, and shorten this crisis, or make it not any longer than it absolutely has to be, is to work together, following the advice of our medical officer of health, and doing all of the things that she advises to stop the spread of this virus as soon as we possibly can do it. That means starting now. Please do what you have been asked to do. Your ability to get your life back, and our ability to save lives depends on you doing what you have been asked to do. Thank you, and now Dr. de Villa will speak to you.
Thank you, Mr. Mayor, and good afternoon, everybody. As of 1 o'clock this afternoon, there are 591 confirmed cases of COVID-19 in Toronto, and this is up 50 from yesterday. There are 67 cases in hospital, 30 in intensive care units. Approximately 24% of our cases in Toronto are attributed to community spread, and 30 people have recovered. We've also learned that there have been approximately 12 physicians, 13 nurses, and 6 other healthcare staff who have tested positive for COVID-19. As I've said before, these numbers are constantly changing, and we should expect that they will increase in the coming days and weeks. We will be posting this information online so that it will be available there for your reference. I have also, unfortunately, been notified of 2 recent deaths related to COVID-19 here in Toronto. A man in his 70s was admitted to Scarborough Hospital last week and sadly died yesterday. And a man in his 80s was admitted to St. Michael's Hospital also last week and passed away last night. I extend my sincerest and deepest condolences to the families and friends of these two men who passed away. To date, there have been 6 deaths from COVID-19 in Toronto. The numbers I've just presented to you are indeed a significant increase from last week, and I expect that we will continue to see similar patterns in the coming days ahead. I would like to take this moment, though, to acknowledge the tireless efforts of our healthcare, frontline, and essential workers, including our firefighters. We need to support them at this critical time so that they can continue to care for our community. As you may have heard, we recently learned that some of my colleagues from my very own team at one of our Toronto Public Health main offices, located at 277 Victoria Street, contracted COVID-19. Given that COVID-19 is spreading in our community, we were prepared for this unfortunate situation. Currently, there are 8 Toronto Public Health staff who have COVID-19 and are at home in self-isolation. We've carefully assessed this situation, the potential health risk to our team, and have provided instructions directly to the close contacts of these individuals. I have also asked for the vast majority of our staff to work from home. Those who are unable to work from home are wearing appropriate personal protective equipment while working at our office located at 277 Victoria Street for the next 14 days in order to prevent further virus spread. Since COVID-19 is not spread through the air, a building is not considered at risk simply because there has been a case or cases in a building. It is in fact those that have had close and prolonged contact with a COVID-19 positive case that are considered to be at risk. We've conducted enhanced cleaning of the office in order to protect our staff as well. And of course, the health, safety, and well-being of our team and our community is our top priority. Our current focus at Toronto Public Health remains on our COVID-19 response and on protecting the health of our city. Given that the virus continues to spread in our community, we can expect that there may be further COVID-19 cases amongst public health staff and other essential service providers who are keeping our city running. At this time, I would like to acknowledge the many personal sacrifices of my team, their hard work, and their commitment to responding and to providing for our COVID-19 response. I am truly very, very proud and consider it the highest privilege of my career to be part of such an incredible team of health professionals. They are truly second to none. I understand that it is difficult to hear that some of our frontline health workers and essential service workers have COVID-19. It is important to remember that we find ourselves in the midst of a global pandemic. Looking at other cities and looking at other countries all around the world, we should expect that unfortunately, more of us will get sick. And for some, very sadly, it will be fatal. This is why it is so important to stay at home, to reduce virus spread, and to protect our frontline health workers, our healthcare workers, and our essential service workers. We need to protect these people so that they can continue to protect us. People shouldn't have to die. People shouldn't have to risk death taking care of us because others won't practice social or physical distancing. This is simply not acceptable. In closing, I want to commend the province for today's actions to support stronger public health measures to contain virus spread and to protect our public, including recommendations for people to stay home, except for essential reasons or purposes, and for individuals over 70 and others with compromised immune systems or underlying medical conditions to self-isolate. We need to protect our community's most vulnerable residents, and I fully support these recommendations. Now is the time to scale up our efforts. I'm in active discussions with all of our partners about the potential for increased measures. We still have an opportunity. Our city still has an opportunity to limit the impact of this disease. The physical distancing measures that we are asking you to take are absolutely critical to our health, both as individuals and as a city. Please stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. We are continuing to respond to concerns about people using parks amenities and continuing to gather in parks. The set fine for this offense is $750, with a maximum fine of $5,000. Education continues to be the first line of enforcement. Any member of the public who has concerns about inappropriate park usage should call 311 with their concerns. Please do not call 911 for these issues. Police are working with park staff right now, conducting proactive enforcement and continuing to support the city as requested. Charges have been laid and will continue to be laid if this behavior continues. Parks ambassadors have also begun a downtown hotspot patrol and education blitz. We are continuing to reinstall removed signage, locks, and caution tape. Parks and transportation staff are installing barriers at hotspot parking lot locations that do not have existing gates. Staff are deploying electronic portable signs near busier parks to advise of closed parking lots and closed park amenities. Since March 24th, municipal licensing has received 385 complaints relating to physical distancing in city parks. The city is very serious about this issue, and I am asking those who are ignoring this very clear public health advice to understand why we have implemented these restrictions. This is only being done in an effort to protect public health and safety by doing all we can do to limit the spread of the COVID-19 virus, as Dr. de Villa says, while we still can. With respect to the enforcement of the provincial orders, since March 24th, municipal licensing and standards have responded to 197 complaints and issued 19 notices for failure to comply. And Toronto Public Health has attended 232 bars and restaurants that were identified as non-compliant last week, 73 of which were closed, and 10 warning letters were issued for premises non-compliant with the dine-in prohibition. Our Emergency Operations Center is working hard to manage the use of personal protective equipment in response to the continuing global supply chain issue. While there has been no change to the levels of emergency response that our public receive, protocols are in place whereby the numbers of first responders making contact with a patient who may have COVID-19 are being controlled. Of course, the number of responders required to manage the medical emergency will be used as required, but automatic entry by second arriving crews is now being controlled. In response to a number of questions, I also want to clarify that the City of Toronto is not responsible for, nor are we managing the supply and use of PPE in hospitals and other provincially operated healthcare facilities. The province of Ontario manages and supplies these facilities directly. The City of Toronto is managing the supply, distribution, and use of personal protective equipment by City of Toronto employees and in City of Toronto operated facilities. We are all hearing reports of COVID-19 infections affecting a number of our city staff, including our first responders. The COVID-19 virus does not discriminate as to who it infects, and as rates of community transmission increase, our first responders and frontline staff are being infected too. Our thoughts and prayers go out to each and every person who is fighting this terrible virus. We wish them all a full and speedy recovery. I want to reassure everyone that all the recommended precautions are being taken to ensure that our essential and critical services remain uninterrupted, and that our staff are being provided with the equipment that they require to work safely. Our fire, paramedic, and police stations remain open, and our emergency response levels remain intact. In closing, I want to take this opportunity to thank the city's occupational health and safety staff, who have helped us tremendously throughout this pandemic and continue to ensure that our city staff are safe and remain properly equipped. As I've said many times, this is a well-coordinated effort requiring the skills of many professionals within the Toronto Public Service. Thank you.
Thank you, Chief. We'll first question to the only reporter in the room right now, Matt Bingley from Global News.
Dr. de Villa, over the past week and including today, you've said repeatedly that you would look at the possibility of suspending more civil liberties if people are not following these plans for physical distancing. I'm just wondering, when you look at the escalation over the weekend of people ignoring these things, removing locks, jumping over fences, and also just how that's affecting healthcare workers, what would your red line be before you actually recommend that these happen, and what those further restrictions could actually include?
Well, I think as you've heard, we're all paying attention to what's happening and certainly observing and taking very careful note of the behaviors that are going on out in our community, and looking at whether social distancing is occurring as we had hoped it would, and as we're urging people it should. And as I'm sure you can appreciate, jumping things up to another level, thinking about going beyond what we're currently doing is actually a very complicated task. Restricting civil liberties is not something that should be done lightly. So when you've heard us speak, we're actively in conversation with the many partners that would need to be engaged in such an effort, and recognize that what we're doing here is really about protecting the health of the city. We are continuing to ask people to step up, to do the right thing, to engage in physical distancing and social distancing in order that we can return to regular life in our city, so that we can enjoy the many amenities and the many freedoms, frankly, that we enjoy on a regular basis in our city.
If I could just follow up, complex as they may be, what could some of those further restrictions include?
Well, there are some restrictions that certainly would be under the purview of existing public health legislation. There are orders that can be made under existing public health legislation, and there are certainly orders that can be made by other levels of government, particularly those that restrict civil liberties.
Just have one last question. Just when it comes to, last week you were talking about long-term care homes and other city facilities that I think it was 17 that either had one individual who was either staff or resident who was positive with COVID, and you said there were 3 facilities that had outbreaks under your definition. Can you give us an updated numbers on those and how many outbreaks you're actually seeing now?
So Matt, I know that there is an increase. I don't have the exact numbers with me, but I'd be happy to give those to you later.
Cool.
Okay, we'll go online now to Jennifer Pagliaro from the Toronto Star. Jen, go ahead.
Hi, my question's for Dr. de Villa. How do the cases at the Victoria Street office affect the work of those staff? Specifically, I understand that staff manning the COVID hotline on the 10th floor were impacted, and just wondering, given that I understand many of them don't have work phones, whether they're able to continue that work.
So thanks for the question, Jennifer. We do have other hotline locations. So at this point in time, the work that is happening, our hotline activities are actually occurring at other Toronto Public Health and or city locations. Because you're right, it is difficult to do hotline work from, on a work from home basis. Fortunately, there are other activities within the public health response that can be done on a work from home basis, and those activities are continuing.
So what does that mean? I know that the hotline has been inundated with calls. Are you reassigning work so that you have the same number of hotline workers? I'm just trying to understand what that means for people who I know are relying on public health nurses contacting them and other public health staff contacting them.
So as it turns out, because we have actively been training staff and increasing the number of staff deployed to the COVID-19 response, I'm happy to report that the wait times on our hotline have been extremely low, and on certain days over the course of the weekend, there was no wait time whatsoever. So we have made sure that we have additional staff trained and available to address the hotline activities as part of the response. We have other locations where staff are seated and performing those tasks, and we will continue to keep an eye on that.
Okay, we'll go to Mark Douglas at 680 News. Mark?
Thanks, Brad. Question to Mayor Tory, and this will be very similar to Matt's question about what's the red line here for the next for scaling up the civil liberties. Mayor Tory, what more needs to happen to see the next level of curtailing civil liberties or issuing orders for public health orders, and why not do that today, given that there's more deaths and doctors and nurses and frontline essential workers in the city are becoming infected?
Well, certainly I'm deeply concerned about the fact that frontline workers, or for that matter anybody else in the city, is becoming affected, and we also know that projections are telling us more people, including, I'm sure, unfortunately, some frontline workers will be affected by this. But history has also shown us that when you draw these red lines and sort of say out there, this is the red line, that can be a mistake in terms of the complexity, both in terms of the different partners that are involved in actually implementing these decisions. The complexity of that doesn't lend itself to an answer that says at a given point in time, a given number, that there's going to be a red line. I will just say what Dr. de Villa said, what I said in remarks today. We are actively engaged in discussions with each other because there are some orders that I could give as mayor and many others that Dr. de Villa could give, but there are also many other partners involved in public and private sector in order to carry those out effectively to achieve the desired result, which is to save lives, increase physical distancing, protect the health of the people of Toronto, and make sure that we bring this crisis to an end as soon as we possibly can. And so those discussions will take place and decisions will be made, and we will come forward as that happens, as you saw happen today with regard to senior citizens. It's something that is evolving every day, and we're on top of it in the sense that we're doing carefully but as quickly as possible and as comprehensively as possible what we need to do to protect the health of the people of Toronto.
Thank you. And to follow up for Dr. de Villa, I won't get you to repeat the same answer that you've already given, but on another topic then, do you believe that there's going to come a day when these daily reports will deliver a number of new recovery cases that outnumbers the new infection cases? And how far away do you think that might be until we see those kind of numbers?
Well, I do hope we get to that day sooner rather than later. Very difficult to talk about or to imagine when exactly that might be or to predict that with any kind of precision. As you've heard us say over the last several weeks, this has been a very complex situation, rapidly evolving with very little periods of time where there's any degree of constancy. We are constantly, learning new information that figures into our, planning and understanding of what the best response is. So for now, I think, my plea to the residents of the city is that we will get to that desired point. We will get to our desired objective sooner rather than later, depending on how well people step up to the plate and do the right thing by staying at home, only going out for those most essential needs and purposes, maintaining social or physical distancing so that we can bring this virus under control as soon as possible and try to get back to regular life in this city.
Francine Copen from the Toronto Star.
Hi, I have 3 questions. One is for Dr. de Villa, and it's a follow-up on Matt Bingley's earlier questions about what could the further restrictions include. Dr. de Villa, you mentioned that there were provincial orders and federal orders that could be invoked. I wondered if you could give us one specific example, perhaps?
So one example of the, you know what I'll do is I'll speak about public health orders because they're more within my bailiwick. So the kinds of things that we might do, and we do this on a regular basis, there is existing public health legislation that allows us to use authorities and powers in order to control communicable disease risk. So if there are, for example, particular individuals who are infected with COVID-19 who are not complying, say for example with instructions to isolate, those individuals could be ordered to isolate in order to limit spread. So that's one example of the kinds of orders that are available for public health officials to use in order to control or limit the impact, the negative impact of communicable disease on a given community or population. And COVID-19 is not the only circumstance in which those could be used and in fact or have been used. There are other infectious diseases where from time to time we have to use these kinds of orders. But as you've heard us say here at this table many times before, our approach is to try to bring people to the right actions, to engage in the right actions on a voluntary basis. We try not to use orders or to use those very restrictive means unless absolutely necessary.
And I have a second question for Dr. de Villa. The City of Toronto, employees with the City of Toronto in employment and social services at 111 Wellesley, have they been sent home and because of COVID?
I can't speak to that at this point. I'm sorry, I don't have an answer for you, Francine.
Okay, and then the last question for probably Chief Pegg, the $750 fines for people who are using park amenities that have been closed. Could a person also get a fine for failing to maintain a 6-foot distance from someone else?
Sure, thanks, Francine. So there are a number of enforcement opportunities, I would say, or a number of enforcement instruments. I will say that they are continuously evolving. So I think we can all appreciate that these are originating largely out of orders being issued under the Emergency Management and Civil Protection Act, and that is pretty much the opposite of normal daily business. So putting the legal constructs in place in order to identify the appropriate enforcement agency and the appropriate methodology is something that has been ongoing from the very commencement of the state of emergency and is ongoing today. What I will say, though, if you'll permit me just to take a slightly different tact, I want to draw an example. Each and every day in this city, in the role that I serve normally as the fire chief, when we are responding to and dealing with, take a fire, a large fire as an example, in the course of that emergency operation, there are times when I will or my team will make decisions about evacuation perimeters and about moving people out of places because there are imminent risks and threats to their safety. We do that only when it's absolutely necessary. And I will say, under the overwhelming majority of the time, people comply with those orders because they understand the significant risk that they are absorbing or assuming by not. I gotta say that in this circumstance, the chief, if you will, of this global health or global public health pandemic is Dr. de Villa. And the chief is issuing a very clear directive and very clear orders and advice in order to keep us safe. The answer to this really and truly isn't one of enforcement. It is one about understanding the significance of the event, respecting the fact that the undisputed experts are giving us the best advice and that they're giving us that advice for the purposes of keeping us safe. Enforcement really does need to be our last effort. Our first effort needs to be for us to get real about protecting our safety and the safety of the rest of the residents of our city.
Okay, Scott Lightfoot from CTV News. Scott?
Thanks, Matt. Question for Dr. de Villa, just following up on what Jennifer asked for the first question there. The 8 employees, are they all working in the same area of that building, same department? And is there any chance that these people have contracted the virus through their work with Toronto Public Health, i.e. through the frontline investigations that you've spoken of many times?
So, it's difficult to say where people have acquired infection. That is part of our assessment. And of course, as you know, I don't disclose the individual details of any particular case or investigation. I do think that it's important to note we have community spread. We can expect that whether we're talking about those who work within Toronto Public Health, those who work for other divisions within the city, those who are providing essential services through other organizations, we will expect to see cases amongst these individuals. So we were not surprised to hear of this, as unfortunate a situation as it was. I think to another point in your question, when it comes to the work of public health in responding to an infectious disease outbreak, and when it comes to case and contact management, there is a lot of interactivity. It's actually not that different in the level of interaction between the various people involved in case and contact management compared to what you might see within a healthcare setting. You often have to confer around the details of a case or the details of the contacts of a case. So you can well imagine that there are many meetings and discussions that take place, and therefore those provide an opportunity for virus to spread between individuals. That being said, as I mentioned earlier, we do have community spread. We should expect to see such cases happen within the public health workforce, the healthcare workforce, essential services workforce. But that's why it's so important, fundamentally, for people to stay home. Staying home is the best thing we can do to protect ourselves, our families, and notably those essential service workers, including the public health workers who are working around the clock to protect our city from COVID-19.
And can you just speak to, you mentioned some of the preparations that were in place for people to work from home where possible, but can you just talk about what preparations Toronto Public Health has in place to ensure that operations can continue if a number of your frontline staff are forced to isolate or become ill? I mean, this is an incredibly busy time for your people, and they're doing sort of the backbone of the work in this city. What preparations are in place if a large number of them were unable to do the job?
So what we have been doing at Toronto Public Health since the beginning of this response was ensuring that we had continuity of operations plans in place, and as well making sure that we were training as much of our workforce as possible. Part of that was to make sure that there would be people to spell each other off. As we talked about, Mr. Mayor mentioned that this is a marathon, characterize this response as a marathon rather than a sprint. So we were preparing all along as this situation emerged that we would be training staff on an ongoing basis to ensure that we would have sufficient workforce numbers in order to allow for a very robust response. So we have relied on those plans. We continue to train people within Toronto Public Health to take on the various roles that are needed as part of the response to COVID-19, whether it's case or contact management or hotline activities. We are still training more and more people to join the ranks and to participate in the response.
Thank you. We'll go to Jeff Gray now from the Globe and Mail.
Oh, hi, folks. For Dr. de Villa, first, I think I speak for the whole press gallery. I hope everything with the folks who have tested positive goes well.
Thank you.
I want to ask you, you mentioned this, but why, what was the reason that public health staff were are being brought back or were brought back even within the 14-day period? What is it that they're doing why do they need to come back in that time, whereas, the rest of us would stay home? What's the reason there?
So there are some staff at Toronto Public Health who are not symptomatic at this time and who are essential to the response, whose work is essential to the response, and whose work simply cannot be done from a remote location. So this is not dissimilar to what we see in the healthcare setting. There are some individuals who work in healthcare settings, hospitals, for example, or long-term care homes, who simply cannot work from home, who are not symptomatic and would optimally be isolating or quarantining at home. However, their work circumstances are such that they cannot. So we make sure that we have set them up in a fashion that prevents virus transmission. I talked a little bit about the use of personal protective equipment, masks notably in this case. Disinfection or cleaning of the building, enhanced cleaning is ongoing at the office location in question. But we wanted to make sure that we were able to provide the continued response to COVID-19 in as safe a manner as is possible. So that's what we're doing.
Thank you. But just specifically, they are working with contact tracing or patients or something. What's the sort of specific thing that in general those folks that need to come in are doing? Is there a category?
So there are a very, very small number of individuals working in the building. The vast majority of that small number are actually involved in the case and contact work. Some of that work is very heavily paper-based. There are technological aspects and information systems that are used, but there are some aspects of the work that are just more challenging to do from a remote location. Hence, those people are in the office with all the necessary precautions in place.
Okay, back to Jennifer Pagliaro from the Star. You had another question, Jennifer?
Yeah, Dr. de Villa, just still following up on this. You said that there are 8 who have tested positive, but how many of your staff are in isolation who are showing symptoms and have to stay home, who are in that forced 14-day isolation?
So Jennifer, I'm afraid I don't have an exact number for you, but can go get that for you and provide it to you at a later date.
And can you just comment, I have some of your employees telling me that they were working in close quarters, that there wasn't appropriate social distancing of workstations or in meetings, and as you mentioned, that there are these rules that require them to be in the office, and that they are feeling in some ways, I think, let down by the city. And can you just comment on that?
Well, I'm always sorry to hear, stories like that. I will tell you that we have done our best in order to provide for a safe work environment, and the health and safety and well-being of our staff, as well as the health, safety, and well-being of our community is the top priority. It is challenging, to do case and contact management. I think anyone who has worked within an infectious disease outbreak in a public health setting, anyone who's worked within the context of health care knows that it is often very, very challenging to achieve social distancing or physical distancing, particularly a 6-foot distance, in these sorts of circumstances. And I think that, frankly, we have a very dedicated workforce that was really seeking to provide this important response to COVID-19. I can assure you that as we do with every situation, we are learning from this particular situation. We have responded, I think, in the most appropriate fashion using the best evidence, and we will continue to do the best we can, both by our city and by our staff, in terms of the response to COVID-19.
Did you have one last follow-up, Jennifer?
Yeah, I did, thanks. I just wanted to know if there's any update on the number of cases in the shelter system, and if you know how many of those are actually workers versus clients using that system.
So just give us a moment, Jennifer. Marianne Bedard is just going to take the microphone.
Thank you.
Hi, Jennifer. So let me confirm, we still remain at 4 confirmed cases of clients in the shelter system, and we have learned of one staff member who works for a purchase of service agency. All of those cases are connected to public health, and they're undergoing the case and contact investigation.
Okay, thank you very much, everybody. For those reporters online, just so you know that all questions now will be via online. Tomorrow there will be no more journalists present in the room. There is one TV pool camera. We'll continue to provide that, and all questions will now be online. Thank you for joining, and we'll talk to you tomorrow.